Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Montreal Cognitive Assessment MOCA Test for Dementia. The Montreal Cognitive Assessment, MOCA, is a test used to detect mild cognitive decline and early signs of dementia. It can help identify people at risk of Alzheimer's disease and screen for conditions like Parkinson's disease, brain tumors, substance abuse, and head trauma. /r/n/r/n Introduced in 2005, the MOCA test is an update from the older MiniMental State Examination MMSE, introduced in 1975. It contains 30 questions and takes 10 minutes to complete. While the MOCA test is useful in detecting dementia, it cannot differentiate between the different dementia types. /r/n/r/n There are advantages and disadvantages of this important screening tool. On the one hand, it is simple and quick to administer. On the other, training is needed to properly administer the test, and a person's education level can influence the results. /r/n/r/n The MOCA test is a simple, in-office tool that can quickly determine if there is any impairment in a person's cognitive function, including their ability to understand, reason, and remember. /r/n/r/n The test is used for adults 55 to 85 with early signs of dementia, the progressive loss of intellectual functioning, especially memory and abstract thinking. /r/n/r/n If the test indicates that a person has mild cognitive impairment, MCI, additional evaluations may be done to check for suspected causes, like /r/n/r/n The MOCA test can also check for MCI in people with known conditions such as /r/n/r/n According to the Centers for Disease Control and Prevention, CDC, around 5.8 million people in the United States have Alzheimer's disease and related dementias. Over 95% of those affected are 65 or older. By 2060, the number of Alzheimer's cases is predicted to rise to 14 million. /r/n/r/n The MOCA test is based on scores with a maximum score of 30. It takes 10 to 12 minutes to complete. /r/n/r/n The MOCA test examines 7 domains, aspects, of cognitive function with a total of 11 different exercises and tasks. /r/n/r/n The MOCA is similar to an older test called the MiniMental State Exam, MMSE. Both tests use a 30-point scale and take only a few minutes to complete. /r/n/r/n Both the MOCA and MMSE have their benefits, limitations, and uses. /r/n/r/n On their own, neither test can diagnose the cause of cognitive impairment or dementia. /r/n/r/n 30 questions with a maximum score of 30. /r/n/r/n Evaluates 7 domains of cognition. /r/n/r/n Executive/visuospatial function, naming, attention, language, abstraction, recall, and orientation. /r/n/r/n score of less than 26 indicates mild cognitive impairment. /r/n/r/n take around 10 to 12 minutes to complete. /r/n/r/n questions are more difficult. /r/n/r/n has a higher sensitivity for mild cognitive impairment but less value for people with moderate to severe dementia. /r/n/r/n At detecting early dementia. /r/n/r/n 11 questions with a maximum score of 30. /r/n/r/n Evaluate 5 domains of cognition, orientation, registration, attention/calculation, recall, and language/r/n/r/na score of less than 25 indicates mild cognitive impairment /r/n/r/n takes around 7 to 8 minutes to complete /r/n/r/n questions are less difficult /r/n/r/n has a lower sensitivity for mild cognitive impairment but is able to monitor for subtle changes in people with moderate to severe dementia /r/n/r/n better at monitoring people with known dementia /r/n/r/n. The total score on the MOCA test ranges from 0 to 30. The scoring per domain is broken down as follows, /r/n/r/n because a person's education can limit their comprehension of certain tasks. 1 point is added to the total score if a person has 12 years or less of formal education. /r/n/r/n after tallying the MOCA scores, the results can be interpreted as follows, /r/n/r/n among the advantages of the MOCA test, /r/n/r/n among the disadvantages of the MOCA test, /r/n/r/n. The MOCA test is generally better at detecting MCI and early dementia than the MMSE test. This is based on comparisons of the sensitivity, the ability to correctly identify people with a disease, and specificity, the ability to correctly identify people without a disease, of both tests. /r/n/r/n A 2015 study published in BMC Geriatrics reported that the MOCA has a sensitivity and specificity of 90% and 87% respectively in detecting MCI. By contrast, the MMSE has a sensitivity and specificity of 18% and 100%. The MMSE was only better at detecting when someone doesn't have MCI/R/n/R/n while the MOCA test is an important tool for the diagnosis of early dementia. It is not perfect. A test sensitivity of 90% means that the MOCA will return a false negative result in roughly 1 of every 10 cases. /r/n/r/n For this reason, the MOCA is commonly used alongside other cognitive tests with ongoing evaluations to check for signs of decline. As a standalone test, the MOCA may not be enough to make a firm decision about a person's cognitive health, particularly if the results are borderline. /r/n/r/n The MOCA test is one of the most widely used tests for detecting dementia, but there are others that are sometimes used to detect mild neurocognitive impairment and the early signs of dementia. /r/n/r/n The St. Louis University Mental Status, SLUMS, examination is a screening test for Alzheimer's disease and other kinds of dementia. It is an alternative to the more widely used MOCA and MMSE and consists of 11 questions that help a healthcare provider evaluate skills like /r/n/r/n. The various questions are scored from 0 to 5, with a maximum score of 30. A score of 0 to 20 indicates dementia, while a score of 21 to 26 indicates mild neurocognitive impairment. Anything over 26 is considered normal. /r/n/r/n Studies have shown that the SLUMS test has a similar reliability to the MOCA in detecting early signs of dementia. Others suggest that it may be far superior to the MMSE in doing the same. /r/n/r/n The SLUMS test has also proven superior to the MOCA and MMSE in the detection of cognitive impairment in people with a traumatic brain injury, TBI. Because the SLUMS test is slightly more demanding, requiring basic math skills, it may be more sensitive to changes outside of the realm of aging-associated conditions like Alzheimer's. /r/n/r/n The Alzheimer's Disease Assessment Scale Cognitive Subscale, ODIS-COG, is used to diagnose the severity of dementia in people already diagnosed with dementia. The ODIS-COG is the standard most commonly used in clinical trials and is considered the gold standard for assessing a person's response to Alzheimer's treatments. /r/n/r/n The ODIS-COG consists of 11 parts that assess skills like /r/n/r/n. The various questions are scored from 1 to 5, with a maximum score of 70. Higher scores indicate worse cognitive dysfunction. Scores of at least 18 indicate cognitive impairment. /r/n/r/n. The ODIS-COG requires high levels of training for the results to be qualitative. /r/n/r/n. The Short Portable Mental Status Questionnaire, SPMSQ, is a simple test that doesn't require any writing or drawing. It can be administered anywhere and consists of 10 standard questions. /r/n/r/n. The SPMSQ is evaluated based on the number of errors you make as follows: 0 to 2 errors, normal, 3 to 4 errors, mild impairment, 5-7 errors, moderate impairment, and 8 or more errors, severe impairment. /r/n/r/n. For the assessment of mild neurocognitive impairment, some studies have shown that the ODIS-COG is comparable to the MOCA in reliability. /r/n/r/n. However, researchers with the U.S. Preventive Services Task Force, USTF, argue that the SPMSQ has a lack of studies evidencing its effectiveness, or that it is unclear how useful the evaluation is make clinical decision-making. /r/n/r/n. The Confusion Assessment Method, CAM, is an evaluation used to assess delirium. Delirium is similar to dementia, but it is not the same. /r/n/r/n. While dementia generally worsens slowly over months and years, delirium starts suddenly and can change dramatically over days or weeks, caused by things like a TBI, alcohol withdrawal, sleep deprivation, recreational drug overdose, and even a severe urinary tract infection. Delirium can develop independently but can sometimes occur alongside dementia. /r/n/r/n. The CAM is not a test taken by a patient but rather a technique used to detect the following symptoms based on an interview with a trained healthcare provider. /r/n/r/n. Delirium can be diagnosed based on the CAM test if the following criteria are met. /r/n/r/n. The other symptoms, such as impaired thinking and psychomotor retardation, may be useful in characterizing delirium and measuring the response to treatment. /r/n/r/n. The CAM assessment can help determine if the symptoms a person is experiencing are unrelated to Alzheimer's and are, in fact, treatable. /r/n/r/n. The MOCA test is a simple, in-office test that can detect mild cognitive impairment and the early onset of dementia. It does so based on 11 questions that evaluate 7 domains of cognitive function. The MOCA has a maximum score of 30, and anything below 26 is a sign of cognitive impairment. /r/n/r/n/r/n/r/n. Thank you. Form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.